Good evening, and welcome to our City Council meeting. It is December the 15th and 6 o'clock p.m. I'll call our last meeting of the year 2020 to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the
United States of America,
and
and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Boy, we were
All right,
together.
thank you. And roll call, please, Ms. Huffman.
Mayor Ortega,
Here.
Mayor Pro Tem Lauer,
Here.
Councilmember Thompson, Councilmember Thompson,
I'm back. I'm here.
Councilmember Estes,
Here.
Councilmember Applegate,
Here.
Councilmember Geek,
Here.
Councilmember Duncan,
Here.
7 virtually present.
Okay, thank you, and welcome back again for this end of the year has been busy. So let's see, we do have some attendees on tonight. So Paul, I think it's Paul that's on tonight. I saw Lisa's name as well. You want to go over the particulars of the buttons and such for the public, please?
Certainly. Good evening, everyone. Thank you for joining us. To participate in this virtual council meeting, you will have logged in with the GoToWebinar software, and you'll see the GoToWebinar interface. If you only see the 4 buttons, click the orange arrow to open the entire user interface so that you can see everything. All attendees' microphones are muted, and there are 2 ways that you can communicate with the City Council. One would be to raise your hand by clicking on the hand button on your vertical menu bar. The other would be to type your question into the question pane in the attendee interface. If you are dialed in via the telephone number and not utilizing the software, you will not be able to raise your hand or to ask a question. To raise your hand, click the hand button on your vertical attendee menu bar. When your hand is raised, the arrow will turn from green to red, and a member of staff will call on you by the name you registered to unmute you. To ask a question, in the questions pane, in the attendees pane, type your question to the City Council and or staff members, and the staff will read the question out loud and direct it to the appropriate party. If the question pane is not visible, click on the orange arrow to open the attendee pane.
All right, thank you, Paul, for that. And it looks like we do have a couple of people from public on tonight, so welcome again. This is our last meeting of the year for 2020, and our next meeting is a ways away. So Sylvia said that was our Christmas gift on January 12th, 2021, and hopefully we're in better circumstances and everything else. And so I'm just going to move right into item 4A, our presentations. To kind of go along with everything that's been happening lately, kind of fast and furious with this vaccination, and watching the governor yesterday accept the first package from Pfizer. And I think there was a video online of a healthcare worker up in, I think, Longmont or Loveland or Fort Collins that was one of the first ones to get it, and he filmed himself. And so we're off and away, and hopefully in a good spot here with vaccines and getting past this pandemic, and hopefully moving on back to what we are used to. With that, I'm going to hand it over to Scott for our presentation by El Paso County Health on that vaccination process. So Scott, go ahead.
Thank you, Mr. Mayor. It is my pleasure to introduce 3 of our distinguished guests tonight from El Paso County Public Health. Very fortunate they're with us. We have Janelle McNair, who is the Emergency Preparedness and Response Coordinator for the county, Christy Durbin, who's the Immunizations Program Manager, and then Dr. Turbush, who is the El Paso County Board of Health President. So again, we really appreciate them taking the time to come down and spend a little bit of time with us, the council, tonight, and talk about the vaccination program and how it's going to roll out. So with that, I will hand it back to you, Mr. Mayor.
Oh, okay. So I thought we were just going. I'm going to go ahead and let I'm assuming Dr. Turbush, are you going to kick us off, or you go ahead, and we look forward to hearing about it.
Can you hear me all right?
Yep, we got you.
Okay, good. Well, first of all, thank you and appreciate the opportunity to present on this historic occasion. Before we get into our presentation, though, I want to make a special shout out this evening to Todd Evans and Sam Geek, who have been singularly important in establishing our El Paso County Public Health Outpost here in Fountain. And I just wanted to say that we cannot do this by ourselves. Public health needs partners. And as I learned in the military, it's coordination, collaboration, communication that spells success. And this partnership with Fountain has certainly been important, timely, and successful. So with that, I'd like to go ahead and begin with a little bit of history. In late December 2019, public health experts became aware of an evolving situation in Wuhan, China. Still in the early stages of identifying the novel coronavirus, the coming days and months would unfold quickly. El Paso County Public Health diligently monitored the expanding global concern, activating incident command structure on February 14th, with the first case reported in El Paso County on March 6th. The days and months have since flown by, with public health and community partners such as yourselves actively engaged in a continuous effort to fight the spread of COVID-19. And as I take a moment to reflect on where we were a year ago, with the knowledge of COVID-19 still in its infancy, I am in awe of how much we have learned and the progress that we have made. The fact that 1 year later, we have a COVID-19 vaccine is a testament to the power of scientific, medical, and public health expertise. We have reached this historic milestone in the advent of the COVID-19 vaccine as a welcome tool that will help accelerate our response efforts. We still have a long path ahead of us to recovery and a return to some semblance of normalcy. But a vaccine ushers in a powerful new phase of response. And with it, a sense of hope for our community. With the first doses of the vaccine being administered in El Paso County this week, we are thrilled to see the months of hard work and vaccination planning efforts begin to come to fruition. And so with that preamble, I'd like to, it's my great pleasure to introduce Janelle McNair, who's as hard a worker as you'll ever find, to give a more comprehensive update on current COVID-19 vaccine planning efforts and strategies. There you go, Janelle.
Thank you so much, Dr. Turbush. I really appreciate that. So good evening. My name is Janelle McNair. I am an Emergency Preparedness and Response Coordinator with El Paso County Public Health. And tonight I'm really excited to share with you some good news that after months of planning, preparing, and collaborating with our community partners, we are operationalizing phase 1 of the Colorado COVID-19 vaccination plan. On December 13th, the FDA issued an emergency use authorization for use in persons age 16 and older for the Pfizer vaccine. Next slide, please. So overall, our objectives for a safe and effective COVID-19 vaccine is that we want to ultimately reduce mortality, morbidity, and the incidence of COVID-19 disease within the community. We want to restore societal functioning, our economy, and additionally, we want to get back to what we know as a sense of normalcy. Next slide, please. So you've heard a lot in the media about all the different vaccine candidates that are currently being considered. And as of right now, we're really focused in on the Pfizer vaccine, as that has been granted emergency use authorization. And more good news to bring to you is that on December 17th, Moderna will be seeking authorization from the FDA as well. So if we're looking at the timeline that Pfizer has taken with emergency use authorization, and the distribution process, Moderna is on the heels, meaning that we could potentially have that vaccine circulating next week sometime in Colorado. So I bring your attention to the other two vaccines mentioned there, the Johnson & Johnson and the Oxford Biomedica, which is also known as AstraZeneca, because the emergency use authorization right now, if it stays on the current trajectory, would be sometime in the late winter to spring. So January, February for Johnson & Johnson, and the February, March for the AstraZeneca. So again, 2 more additional vaccines that we may have to deploy within our community this year, which is great news. Or I'm sorry, next year, which is great news. So looking at the Pfizer vaccine, since that's the one that has been granted the emergency use authorization and is now here in El Paso County, a couple things about that. So it is a 2-dose series. You do have to have both doses to have maximum protection for the vaccine. Additionally, protection from the vaccine is not immediate. Vaccine is a 2-dose series that'll take 1 to 2 weeks following the second dose to be considered fully vaccinated. Additionally, there's some logistical differences between the 2 vaccines, in that the Pfizer vaccine is that ultra cold vaccine that you've been hearing a lot about. So the storage for that is -75 degrees Celsius, and Moderna is a frozen vaccine, so that can be stored, in a vaccination freezer, which is what most people are used to handling that type of vaccine. We do know that this process is going to take time, and so vaccinated persons, the recommendation is that we're going to continue to follow all current guidance in order to protect ourselves and the community. So that would be things such as wearing a mask, staying at least 6 feet away from others, avoiding crowds, washing your hands often, and then following those CDC travel guidance and following your quarantine and isolation guidance. Next slide, please. So this represents our timeline, and so where we are today, you can see is kind of towards the end of the timeline there, in that we did receive the first shipment of Pfizer vaccine in El Paso County yesterday that went to the UC Health Memorial Central Hospital, and they did vaccinate 20 healthcare workers. They are going to continue vaccination of their healthcare worker personnel tomorrow. And so, with that, additionally this week we'll be receiving a shipment of Pfizer vaccine to the Centura system and to Children's Hospital. So those facilities are prepared and ready to execute their vaccine administration plans with their healthcare workers. And all in all, out of the 46,800 doses that the state of Colorado is receiving, El Paso County is receiving 6,700 of those initial doses. With Moderna, the vaccine allocation for the state of Colorado as of today is 95,600 doses, and of that, El Paso County will be receiving approximately 7,500 doses of Moderna. Next slide, please. So what you're seeing here, this graph represents our basically our planning concept of operation, in that we know in the initial phases here, we're going to have those limited doses available. So it's a constrained supply with a very highly targeted administration to a specific population, and that would be our healthcare workers on the front lines, those with the greatest risk of exposure, and those at the high that are our most vulnerable populations. So our long-term care facility residents, skilled nursing facility, assisted living facility. That's in our group phase 1A population. Then what you're seeing here is as allocation and distribution increases, we begin to climb that the upward curve there. And we can then begin to broaden our administration of the vaccine to a greater portion of the population. The red line in the middle of the graph there represents 660 million cumulative doses, and that is based on a population of 330 million people in the United States and a 2-dose series. So in the spring into summer, we're anticipating that we will have enough supply to meet demand. We can broaden that vaccine administration, and we will be utilizing our existing healthcare infrastructure. So you would be able to receive a vaccine at a private provider's office, at a pharmacy, at a clinic, and additionally, public health will be looking to implement what we call points of dispensing. So making sure that every person in El Paso County that wants to receive a vaccine has an opportunity to do so. So we will be working with our healthcare partners to make that vaccine available to every individual, and there is no cost associated with that. And then because right now we're living this in real time, we don't know how long immunity lasts. And so we are planning for a continued vaccination strategy. You receive a flu shot every year, and so we're anticipating that the COVID-19 vaccine could be something that you also receive on a yearly basis, or whatever that timeline is depicted by the data that is looked at by the FDA and CDC. Next slide, please. So this chart here represents what we are referring to as our phased vaccine distribution. And it depicts it in a timeline, in more of a seasonal timeline, in that we don't have exact dates to say, you know, starting on February 1st, we're vaccinating phase 2. It's just all of our vaccinations and the way that we move between phases is dependent upon distribution and allocation, how much vaccine El Paso County gets. And we don't have any control over that at the local level. And so in the beginning, we know, like in accordance with our concept of operation, it's going to be a constrained supply. So in phase 1, the first doses go to the highest risk healthcare workers. These are people who have direct contact with COVID-19 patients for 15 minutes or more over a 24-hour period. Additionally, they go to our highest risk individuals, which include our long-term care, our skilled nursing, and our assisted living facility residents, staff and residents. As our distribution and allocation increase, we're going to move into vaccinating our phase 1B population. And this is our healthcare workers with less direct contact with COVID-19 patients, our workers in health and hospice, home care, dental settings, and our first responder community. And then when we get to, and we hope to have phase 1A and 1B completed by the end of the winter. So then as we move into spring, that's where we anticipate we'll have more supply to meet demand. We'll expand that administration to that broader population, and we will start vaccinating our higher risk individuals and our essential workers, people over the age of 65, people with underlying medical conditions, people who interact directly with the public, such as our grocery workers, our teachers, our child care facilities, workers that serve in high density settings, so people that have that direct interface, and any healthcare workers that were not vaccinated in phase 1. And then finally, around the summer timeframe is when we will be vaccinating individuals ages 16 through 64 without any high risk conditions or anyone that was not covered in a previous phase. Next slide, please. So how this breaks down into the El Paso County population, you can see here, this represents the adult population, so age 18 and older. Our phase 1 is actually the smallest portion of our population, and so that right now is the overall focus for vaccine administration with these limited doses. And then our phase 2 actually, we have a more current graph because phase 2 has been combined into one phase. This just changed very recently. And so 2A and 2B are combined. So you can see that that's actually our largest portion of the population, which would be kind of that spring into, you know, early summer timeframe. And our phase 3 is the summertime population. One thing that I did want to mention is that our federal partners, because this is really important to Fountain with our military community and our military members that we have, is that they will be receiving vaccine allocation through the Department of Defense. So basically anybody that's a DoD card holder is going to be able to receive vaccine through the federal allocation system. So the military has come up with their own distribution and allocation phases, and DoD members are, you know, recommended to follow how the military has determined that distribution to be within that community. Additionally, our VA will be receiving a direct federal allocation, and they will be serving their staff and their VA veterans as well. So those individuals are also covered under the federal allocation of those programs. Next slide, please. And so what this looks like from, you know, a 30,000 foot view and what's happening is, you know, right now this is representing the yellow brick road, so to speak. This is the process of the Pfizer vaccine is moving through It's already sought FDA approval or FDA authorization. It has that. The manufacturer has already begun to ship doses across the nation. The CDC in Operation Warp Speed has determined how many doses the state of Colorado is given, and that is based on pro rata information. So Colorado is 1.69% of the nation's population. And so the CDC allocated these initial doses based on that percentage of the population. Then the state of Colorado determined how those doses would be distributed to the local jurisdictions. And that was done based on percentage of healthcare workers within that jurisdiction. The vaccine was distributed directly to our administration site, which yesterday was UC Health. And in the coming days, it will be our Centura and our Children's Hospital system. And additionally, the safety and the tracking of any sort of data monitoring is occurring throughout this process in terms of safety and efficacy in the population. And then, for example, with Moderna, we would be up here kind of at the start of this blue dot because they have not yet been granted emergency use authorization. So once they do, they'll start down the yellow brick road and follow this process. So this will be how vaccine is basically distributed throughout the nation during the duration of this vaccine administration process. Next slide, please. So what that looks like for the state of Colorado is that you're seeing both blue and yellow dots. Yellow dots represent identified hubs throughout the state, and these were locations that were chosen for their unique abilities to be able to store, monitor, and handle vaccines in ultra cold temperatures. And so the hubs are utilized for other locations around the state that don't have the ability to store the ultra cold vaccine. And so because we know we have another vaccine coming online that is not ultra cold, we do anticipate that some of the hubs are potentially going to go away. However, the blue dots that you see in El Paso County, that represents our providers that are currently enrolled as a phase 1 COVID-19 vaccination provider. Largely, it's our hospital systems here in El Paso County. However, as we continue through this process of expanding our distribution and allocation, our goal is to have a lot more blue dots covered across our jurisdiction and really across the state, because those will then potentially be locations that individuals can go to receive vaccine. So I think that was my last slide. Next, please. So pending any questions, which I'm sure there are probably many, I also have a colleague on the line, Christy Durbin, who is our immunizations branch manager, and she's also a vaccine subject matter expert. So any questions that come across, we will try to field those to the best of our ability.
Okay, well, first of all, thank you to everyone who's been kind of in the middle of this whole thing and trying to deal with it and hopefully get us to a point where we can actually get to here and then moving forward. So I want to start off with a couple questions. Hopefully they may be a little technical and I don't need the whole, just as best layman terms for the rest of us as possible. What's the break point as far as everyone's feeling comfortable with, okay, enough of the population has gotten it that really we can really start shifting back to the normalcy, and I realize that's kind of months away still, mainly because we're waiting on the mass of that population. But what's that break point that everyone's like, okay, we're at a good point, we can take the mask off and do all those sort of things?
Or yeah, so right now, because it's important for everyone to realize that because we're living this in real time, there's still a lot of data and science that we are, we're receiving that as we're going through this process. It's going to be a living process, so to speak. And so we don't know how long immunity lasts right now either. And so it is going to take some time before, certain measures are relaxed and we get back to that point where we don't have to do, the mask wearing and the social distancing. And so there's not an exact time frame associated with that. And when we talk about, herd immunity and what that looks like, it's a pretty large percentage of the population that would have to be vaccinated to reach that. So yeah, unfortunately, we don't have an exact timeline for that, but it's going to be, you know, if you look at through at least the summer months of being able to vaccinate or at least offer the opportunity to receive a vaccine to the majority of the population. And so once we get through the summer, and then, you know, having the data and science to understand how long immunity would potentially last and when people would have to be vaccinated again, I think that's when we'll have a more definitive answer in regards to a timeline.
Okay, and so I guess that's the second part of my question, and I think you guys are probably hearing all the negativity and the stuff that goes along with it, but the efficacy of a vaccination, do we know how long that lasts, or is that part of all this in the middle of living it type of thing we'll figure out? So I get the vaccination, I've got my 2 doses, you know, what is that length of time in between that either possibly I need another one? Is that a for sure, or we don't know yet type of thing?
We don't know yet. Yeah,
Okay.
unfortunately, we don't know yet.
Okay, and we don't know when that would, like kind of like the flu shot. We know every year we have to get the flu shot. We don't know yet still as far as if it's just for example, a 1 year or a 2 year vaccination.
We're anticipating it's going to be a 1 year,
Okay.
but again, it could be a little less, it could be a little bit more. So
Okay. Yeah. Again, it's I know it's one of those things in real time, and you know, and discussing this with a few different people, and just kind of talking about the what ifs and the what nots and things, and just understanding that typically when you're doing a trial of vaccine and these things, they take so much longer, but you're trying to get all this data done at that time so that when you do roll it out, you have those answers already. And so I think that's one of the reasons why we're pushing it so fast, that so we're gonna have to find out along the way too. And I think that's where some of the fear I think people are getting, but I think people are also at a point too that, you know what, let's get past this thing. So I'm gonna check to see if there's other questions, but thank you on that information. Ms. Estes, go ahead.
A couple of questions on when you said that Colorado received what 46,800 doses. Is that one shot? And so we really only are going to vaccinate about 23,000 people.
that's a great question. So no, that all those doses are administered right now. The federal government automatically keeps back the second dose, and they will ship that automatically in accordance with the timeline to receive it within the 21 days.
Okay, and as we move forward, as we get different vaccines on board and stuff, what kind of training is going into getting our people up and ramped up to getting these administered, especially the one that's the ultra cold? Because, you know, there's some pretty strict handling requirements for that. And I worked in a blood bank, so I know about these ultra cold stuff. So
yeah, so with the ultra cold vaccine, right now we're anticipating and planning that vaccine is going to go specifically to our hospital systems, and also to, I didn't mention that our long-term care facility population and skilled nursing and assisted living, we're utilizing a partnership with the pharmacies of CVS and Walgreens, and this is through a federal pharmacy program. And so those pharmacies are going to administer a vaccine directly to those residents and staff, and they will be utilizing the Pfizer vaccine as well. The CDC has put together an enormous amount of trainings, and so has the manufacturer themselves, for how to store and handle the Pfizer vaccine and how to administer it. And so these have been made to clinicians and providers and vaccinators for the last couple weeks, and is ongoing right now as well. So all of these individuals that would be administering the vaccine have access to the trainings that have been put together by the CDC and the manufacturer, and additionally a lot of resources and tools that have also been put together at the federal level, the state level, and also are available at our the local level.
okay, thank you.
Mm-hmm.
One more question, because she brought this up in the doses. So if we have, I get my first dose, and then my 21 days or the 24 days occurs, and I neglect to come back in at that 24, is there a window of opportunity there, or that I have to get it done by, or how does that work, I guess, is the best
There it
question.
is. It's plus or minus 4 days in accordance with the CDC guidance that you could receive that second dose. If you don't come back within that plus or minus 4 days, it's still recommended that you would receive the second dose. You wouldn't start over. And then additionally, the products are not interchangeable. So if you start with Pfizer, your second dose has to be Pfizer. You can't get the Moderna vaccine as a second dose.
Okay, yeah, I didn't even realize that. And then how is data being kept on who gets the vaccine and who doesn't?
Christy, do you want to answer that?
Sure. Can you hear me okay?
Yes.
Yeah.
So all vaccines, we like that when they are inputted into the Colorado Immunization Information System, because then providers wherever you go in Colorado would technically have access to that. So one of the requirements with the COVID vaccine is that it is charted within 24 hours of administration into that system. So, and that will help with, when you go to get your second dose, your provider will be able to look it up in the system, see when you had it, make sure we have met that requirement for time spacing, and make sure that you are getting the correct second dose. So all of that data is kept in the state system. You can opt out of it if you don't want to be a part of SIS. You just have to let that provider know. And then all of the dose data is de-identified and then sent to CDC. So they can track that, the doses aren't just sitting in a refrigerator, they're going into arms and protecting people. So that Colorado Immunization Information System is extremely important in this process.
Okay, thank you. I do have other questions. Ms. Thompson?
Yeah, I've got several. One question somebody asked me was, the flu shot sometimes is egg-based. So if people have egg allergies, they can't take the flu shot. So is this egg-based?
It is not egg-based. It's an mRNA vaccine.
I know, and that doesn't mean anything to the rest of us out here. So just not
I would be. So an mRNA vaccine, basically, it tells your body to create a protein that your immune system can recognize and develop antibodies to fight against. So that way, when you do come in contact with, if you have COVID or if you are exposed, your body knows what to do to stop you from developing symptoms of becoming ill.
Okay, thank you. Slightly understand it better, but we all just have to get it lots of times, right? And then in phase 2, was there any thought to putting bus drivers? I don't see bus drivers listed anywhere because they are exposed to the general public a lot and for probably more than 15 minutes at a time. And especially down here, a lot of our bus drivers are retired, so they may not qualify for the shot until the 3rd round. So I'd like to throw that out there as a thought. You don't necessarily, might not have the answer tonight, but I don't know if bus drivers were included on that.
I think that they would actually fall into phase 2, Janelle, wouldn't you agree? Yeah. So they're essential workers, and they, if they're retired, then they would probably meet the age requirement as well.
Okay, I just didn't see it listed on there anywhere. And I listened to the one this morning. I was on the county commissioners meeting, and I didn't hear it listed there. So, and the governor's call the other day, it sounded like once, and I may have misunderstood what he said because, a lot of information gets said at these meetings pretty fast. But on his call the other day, it sounded like there is no charge for the shot. But once it gets down to your doctor's office, they can potentially charge you administrative or handling charges for the shot.
They can't charge you, the patient, for the shot. They can bill your insurance for an administration fee, but that can't go back to you or the patient.
Yeah, and if you don't have insurance, the provider under the CDC provider agreement must still administer the vaccine to you. And there is a process with the federal government where that provider can seek reimbursement for the administration fee. So as an individual, wherever you show up, if it's a COVID-19 vaccine provider, they must administer the vaccine to you at no cost.
Yeah, I don't want people, especially our seniors or maybe our struggling families, to get an unexpected bill in the mail. That happened to my mom with a flu shot one time. She went someplace that was supposedly free and she got a $119 bill in the mail, so how is there a way that that's going to be disclosed if there is some type of possible fee?
Well, like I said, when they signed the CDC provider agreement to become a COVID-19 vaccination provider, that is one of the conditions that they agree to when the provider signs that.
Okay, all right. And then are people allowed to ask if you want to participate in a program or something? Are they allowed to ask you if you've been vaccinated or not, or would that be considered a HIPAA violation?
That is a HIPAA violation. Your vaccine record is your personal health information.
Okay, so if they want to participate somewhere, they can't say you have to have had it to participate in this event.
I think currently they can't require it, but I don't know what the future will hold. I know some things require a flu vaccine, but I don't see them requiring the COVID vaccine at this time.
Okay, and what about people with allergies?
So severe. Oh, sorry. So folks with a severe allergy, like an anaphylactic reaction, we wouldn't be vaccinating with the Pfizer vaccine at this time. There are a lot of people that have seasonal allergies, or maybe when they eat something, they just don't feel great. Those aren't the allergies that we're concerned about at this time. We would still recommend that they get vaccinated. If they were allergic to a specific component in the vaccine, then we wouldn't want them to be vaccinated either. We would want them to either wait for a different presentation of the vaccine or talk with their doctor.
And where could they find that information out?
So that's the vaccine. Every vaccine has an ingredient list, and they can certainly get that from Pfizer, or I would assume that the CDC would have that as well.
Thank you.
And every recipient of the vaccine would receive an emergency use authorization fact sheet from the vaccinator. And so some of that information is also provided on that fact sheet. And that is a requirement that those providers give the recipient that form as well, that information.
Right.
Yeah, I think some of us are trying to figure out if we should have it or not due to certain allergies, people we know might have. So trying to be preventative.
Yeah.
Yeah, thank you.
Okay, Mr. Geek?
Yes, I was wondering, is the new hub going to be a facility that will handle that? Maybe not right away, but somewhere down the road? The fountain hub?
Oh, you mean for vaccinations as a vaccination?
Yes.
Oh,
Yes.
Christy, do you want to speak to that?
So we are certainly trying to plan out some open pods or points of dispense in the future. So depending on the need in the future, we can identify groups of people that maybe have barriers to healthcare, or they can't receive it from their doctor. We're certainly looking at pods that we can plan to make sure those folks have access to a vaccine. So if there is a large space, I assume we'll be looking at it and seeing if it will be a good option for COVID vaccine clinic.
Thank you.
Okay, a lot of great information for everybody, and exciting, yet there's a lot of apprehension as well, but hopefully everything works out well for everybody and we can keep moving forward. I do want to thank you all for your tireless efforts. I know you guys have just been swamped since February, March, and just hopefully there's a little bit of a light at the end of the tunnel, and you can kind of see some fresh air coming towards your way. But again, this is hopes for a good 2021 and moving forward. So with that, I'm not seeing any other questions. Ms. Kircher, did you have a question? I see your hand up. Is that our issue we deal with hold on.
Sure.
Okay.
Okay, yes, good evening. I'm going to thank you for being here for us. I'm going to be in group number 2 or possibly 3, and I usually get my shots from Safeway. How do I find out when I'm eligible and to get the shot as soon as possible? Do I just keep checking back, or is there some type of a list, or do I have to go through my MD, or what is the procedure for just a general person in the public?
Sure. So when we get to that point where we're getting closer to that phase, we're going to have utilization of something called Vaccine Finder. And so this will also be another tool that the public is able to utilize to find out where the closest vaccination provider would be located. And so that's one method. Additionally, you know, a large part of this of vaccination administration is public communication and education. And so we have a really strong communications team at the health department that is working on messaging and working on, they have a lot of information up right now on COVID-19 vaccine planning on our website at elpasocountyhealth.org. And they will continue to put information on there as well and use a lot of different media outlets and avenues in order to ensure that we have effective communication with the entire population.
So then I will expect to hear something in some form.
Yes, you will. The health department will keep the population informed when we're moving into those phases and when we have enough vaccine to support that. And again, we will be providing that communication to the public.
Thank you.
Yep.
Okay, with that, I think we are, at least our initial questions are answered, and we know who to get in contact with for any other additional questions and things like that. So, Ms. Estes, did you have anything further?
I just had a quick question on the 2-dose thing. Is there going to be follow-up with those people to get them back in? Or are you just relying on them to come back in? And if they don't get the second dose, is there any immunity inferred just with that 1 dose?
So I'll answer your second question first. There's no data right now to support whether or not 1 dose would be effective. So for all intents and purposes, they would not have immunity unless they receive the 2 doses. And then for your first question, there are, depending on where they receive the vaccine, they will receive, well, wherever they receive it, number one, they're going to receive a vaccination card with the type of vaccine that they were administered. And then secondly, a lot of the organizations that are phase 1 providers right now and will be in the future have systems in place to do second dose patient reminders. And that could come in various different forms and what the individual feels comfortable with. For example, if they want to receive a text message, if they want an appointment card reminder, some systems will use a callback system. So there's a lot of different methods for that, but the intent is that that second appointment is scheduled and that individual knows when and where to go to receive the second dose when they receive their first dose.
And I just, as a comment, that not just with the vaccines, I have looked at several counties' websites during this, and I have to say that I think El Paso County's, their data dashboard is the best that I have seen. So kudos to all of you guys for all of your hard work.
Thank you. I will definitely pass it on to our communications and data management team.
And then questions keep popping up, but this will be the last one, I promise, because I know you guys want to get on with your evening. So the last question is, so if you're phase 1 or phase 2, what do you need to prove that I'm in that, I'm eligible in that phase? Or who does a provider need?
So initially, because you know our phase 1 is such a constrained supply, the vaccinations are really happening in the workplace setting. So in the hospital system, you know, in that healthcare facility, and so they have a list of who their employees are. When we get to like the first responder agencies and so forth, we'll be looking at where we are working currently closely with all of our first responder agencies. So they'll have, you know, identification of a badge, you know, or a list from their department. So we'll have that information as we expand and it opens up to a broader portion of the population. There will be people that get vaccinated outside of the phase, you know, and that will happen, and we recognize that. And at the end of the day, people are being vaccinated, and so that's a good thing. And so we will be working, you know, closely. Some of our facilities are looking at doing like an attestation form, so you're signing that you are, you know, an essential worker. So there are several different methods, but when we get to that broader phase where we have more supply, it's going to be, you know, a little bit of we trust your word type thing. Showing up to get a vaccine, you're going to get vaccinated. So, yeah.
Okay. All right. Okay. Well, again, thank you all for coming tonight and just kind of going over this with us. It's again, we're kind of pins and needles, but at the same time, we're very hopeful and you know, we're at a better place in a year and as I said earlier, you guys get a chance to breathe a little bit. So thank you all.
Yeah, and the last thing I just want to say is that we'll have up on our website too, you know, the information about the vaccine. So all of this information is available to the public, the emergency use authorization fact sheets, the, you know, what the reactogenicity would be. So if you know, are going to have a fever or chills after, which is all a natural response to any sort of vaccination. And so that means your body's having a reaction, which is a good thing, but so that you know what to expect. And so we're doing the best that we can to get that information up there so that you can look at it, you can read it, you can be informed, and you can make a decision for yourself as to whether or not you choose to be vaccinated.
Okay. All right. Thank you.
Thank you.
Thank you.
Okay. Scott, did you have anything further to jump on with this?
Nothing from me, Mr. Mayor.
All right, thanks a lot, everybody. Yeah, a lot of helpful information there, and again, we're all hoping that you know, the things work out well. I know there's a lot of apprehension, as I said, and a lot of people are just skeptical at the same time, which I get. You know, we'll see how things roll out, and we'll go from there. So, with that, we'll move on to item 5, our City Council agenda requests and announcements. Let me start off with Ms. Duncan.
Good evening. I just wanted to say how excited I am to have the vaccines out, and thanks to all. I'm so grateful to all who are involved with the COVID-19 vaccine development and planning. This is wonderful. Shout out to our healthcare workers. I'm sending well wishes that everything works out for them and that they're vaccinated and that they're protected against the people they're protecting. Also, on December the 9th, I attended the virtual State of the Region where Scott represented us well. He had us shining. He was representing Fountain as well as he usually does. And for those who had missed it, I'm sure that you can go on the El Paso County site and revisit that State of the Region. It was really good information that was out there. Also, there in the Gazette, I read today that they have a couple of lawsuits that have been filed on behalf of our restaurants to get back open, and shout out to those who have stepped up. I think it was very excessive to close the restaurants from the beginning. So I am so grateful for those who have stepped up to get our restaurants back open. I don't know about anybody else, but I would love to be able to go back to our restaurants and sit down and have a good dinner and not have to bring it home and it's all soggy. And one other thing that I saw on the site today that we have, the El Paso County has a public works and road projects near you that's online. And I thought this was great information. They have long-term and ongoing projects that are happening right here in Fountain. And on that site, it includes the estimated cost of road projects. And this is good information for those who don't know how much it takes for the projects that we have going on, are confused about or have questions about how much it costs for our roads and how much these projects cost. They give us an estimated cost. And so the next time that these things come up on our ballot, that we know that, you know, these roads are costing us millions of dollars, and how our decisions will be made the next time that it's put on the ballot. And that's all I have for right now.
Okay, thank you. And then Mr. Geek.
Yeah, I've just got a couple of things. One, that I'm on that Board of Health, so when I get the information as quick as I can get it, I will make sure that the city knows about it. And I know that they're in contact with John Trilch and Mashia. So as far as the vaccinations and things like that, as soon as that stuff becomes available, I'm sure that we're going to be able to get that where the people in Fountain have an opportunity to get it done. That's all I have.
Okay, thanks, Sam. Mr. Applegate.
Yeah, I'd like to give kudos to our current White House administration that took on this warp speed project that's turned out these vaccines in a time that so many people said they could never do. I think they did a wonderful job, and I think their intent was to save lives in America. I think they've done good for that. That's all.
Okay, thank you, Mr. Applegate. I agree with you. Ms. Estes.
I don't have anything this evening. Just glad that the vaccines are here and looking forward to the next 6 months of getting us back to normal.
Yeah, okay. All right, Mayor Pro Tem.
I'd like to say I echo everybody's sentiments that have already been expressed, and otherwise I have nothing.
Okay, thank you. Ms. Thompson?
Yeah, good evening, everyone. I also think Scott did a fantastic job on the video that he did that was presented at the State of the Region. I thought it was fantastic. They went virtual this year, and I hope they'll consider potentially a hybrid event. I believe they had at least as many, if not more, people attending that State of the Region address than we've had in past recent years. I would like to give a huge Christmas hat off to the Blue Santa event that went on Sunday. The team that collected the toys and pivoted this year, changed that event totally from being an in-person event where they provided a meal, and many of you have attended it in the past, to this year being a totally contactless drive-through event for the people to pick up their toys, and the organization of that was really unbelievable. So thank you to the team that put that together and everyone that helped before the event, during the event, and after the event. The kids in our community were once again very, very blessed with the generosity of everything, but those people worked really hard, and they were really tired, and they had a great event for our police explorers to help with. They were out really helping with it, so that's great. And just thanks to Commissioner Waller for his service he's done for the past 4+ years. And I attended that event today for his thank you send-off. Unfortunately, their meeting got a little long-winded, and I had to get off at about 11:30 and go do some things. So I asked Natalie Sosa, a name that everybody should recognize from around here, to read what I wanted to say today. So thank you. And we continue to work with the placemaking event, and Tamara's on that with me, and I think we're going to have some fun stuff coming down here next spring in the downtown area. So a lot of things continuing to go on. Our staff is really working hard at everything that normally has to happen, plus adding the layer of COVID onto their plates. They've just, I think, done a phenomenal job this year. So thank you very much, and my hat's off to the restaurant suing the governor. If that's what it's going to take to get our restaurant restrictions off. Our restaurants have not proven to be super spreaders. So thank you to those people taking and doing that, and I hope it doesn't take that with our legislator to get their power back. We need to have the division of powers back within our state of Colorado. Thank you.
Okay, on that restaurant thing, I attended the CML thing today. I think Tamara was on there. There was a Tamara that didn't have a last name, so I'm assuming it was her, but if not, I'll give you the credit anyway. But they were talking about this new 5-star program to basically allow restaurants to come back and be open again, and a lot of layers that they were presenting. All of this information is supposed to come out tomorrow anyway. To me, it just sounded more of the same. Of your county's got to prove that they're back in the downhill slide, and it's a lot of kind of hoops they have to jump through again, just to really, and all it is just to go down a level than what we're currently at. And so, like if we were at orange, which we currently are, and we want to get back down to, I can't remember what the next color is, backwards, where we need to be, there's an opportunity for those businesses to get there. But any hint of us going back up or something, it kind of railroads that whole process anyway. And so there's that attempt there, but to me, it seemed a bit futile, and it also seemed more like an opportunity to for the governor state to push their agenda of this, the mass, and what we're doing is right and not. I can tell you that the numbers that they've showed us, just in our the curves and things, Colorado was able to manage with the Thanksgiving, what they were thinking would occur, which is occurring in other states where those numbers are still climbing today. But ours have really started on the back, going back down. So, I think the lawsuits, probably more of a show right at this point, just because I think by the time all that stuff gets worked out with the lawyers and all those people involved, it's going to be too late. But hopefully it'll affect change if something occurs like this again. And as Sharon says, the not one person's making all those decisions in the end, but that'll be a bigger part of that discussion, I think, too. And one of those things that hopefully as we look back on, everyone who's involved can hopefully prevent those things from happening again in the future. With that, I did want to, knowing this is our last meeting of the year, if the council would indulge me real quick on a decision, and I don't know how best to do this, so I'm going to look to Troy as well. I talked to Scott a little bit about it today. I did notice that the president signed an executive order declaring Christmas Eve a federal holiday. And so I was a little excited about that, thinking, oh, our employees get to have an extra day off. And then I realized, wait a minute, it's federal, not state or local government. And so I asked Scott, I said, what would be the process of us, trying to do that here? And he reminded me that we tried that 2 years ago. I think it was 2 years ago, to allow our employees to have both, well, it was at the time, both Christmas and New Year's Eve. There was a discussion around the costs involved, and Scott kind of was explaining it to me, and it starts in with numbers and dollars, and that's not my wheelhouse, obviously. But for me, it's really about the work and things that got put into this year, and really every year. You guys do an awesome job of this staff does a great job with what we have, what money does come in and how we use it, and we still get a lot of major big accomplishments and milestones and projects done. And we can toot those horns all the time. You're always going to have those detractors, but I know, because I'm in the middle of it and I see all the good work that you guys do, and being able to give a little bit back on as far as the council can. And so I'm asking council tonight, and if you would be agreeable to allowing, which apparently has to come to us, allowing, and Scott and or Troy, if you guys can help me with how do we make this decision tonight, because this is our last meeting and Christmas Eve is in a week and a couple of days. I think most everybody works a half a day anyway, and we're talking, of course, those who aren't the first responders, those people who need to be on anyway, but everyone who would take Christmas Day off, allowing them to have that extra half day that they don't have off now. Again, in the past, it was both Eves, Christmas and New Year's, but really for me, if we can allow this Christmas Eve and just give everyone that extra time, and honestly, and we could be real here, what really occurs and happens in one half of a day before a big holiday like that, and everybody else is already off anyway. So I don't know what the process would be for that, but I would like to see if we can have an agreeable council, number one, if we can offer that for our employees for this year. The other thing I was thinking about as well is because of COVID and where we're at, I don't think that we're going to be able to do, or the staff is going to be able to do their traditional employee recognition lunch that usually occurs in January, because we'll still be in this thing, even though the vaccination's here, but we're not even going to be touched by it yet. And so I do want to offer that as up for I don't want to spend a lot of the night on this, and so hopefully it's something that everyone would be okay with, and if not, I'd like to hear that and reasons why, and we can kind of go from there. So I'll open up to council first. If anybody has any like huge, no, I don't think this is a good idea, or it's a great idea, whatever it is. Let's talk about this super fast, because again, I want to get this. If we can all agree with it and make it happen, I would love to make it happen for our staff. Ms. Estes.
I think it's a fabulous idea, and kudos to you to thinking of that. And I think it's a wonderful thing for our staff that has worked so hard through a very trying year that they deserve some kind of Christmas bonus.
Yeah, okay. Miss, I hear Mayor Pro Tem there making some chuckles, so go ahead, sir.
Well, Tamara actually said almost everything verbatim of what I was going to say. I couldn't agree more. I think it's a excellent idea, just the right time. And if it gives our folks one tiny little bit of feeling that we recognize the effort they've put into this year with crazy adjustments having to be made in real time, sometimes minute by minute. If that helps them understand how much we appreciate that, then I am 100% all for it.
Okay, thank you. Mr. Applegate?
Yeah, I agree. Give them the day off. You got a good point.
Okay, thank you. Mr. Geek?
I'm 100% support.
Let me see. Ms. Thompson?
Absolutely.
Okay. Ms. Duncan, you haven't said anything. I want to give you an opportunity. Everyone else did. Go ahead.
We have the best staff there is, and I think they deserve that day off. So I'm in 1,000 agreement on that.
Okay, it would have been funny if Ms. Duncan's like, no, I think it's a bad idea. I know she wouldn't do that, but it would have just been kind of funny. But with that, Scott or Troy, what do I need to do? Can I make a motion and we vote on that? How do we need to do this? What's the next
I
step?
think the council should make at least some kind of formal motion. I think you can act on motion here, and then the staff should be able to implement it if a consensus is reached. So I think on motion would be the best way to do it if the council member wants to make a motion. Scott, unless you disagree.
Okay, Scott.
I'm not sure I followed I'm not sure I heard him. But here's my only worry, not worry, sorry, just from the mechanics of it process. Number one, just a clarification. Are you suggesting that we modify our policy so that it's so from here on out it's Christmas Eve is off, or this is sort of like a one-time 2020 type of thing? I just want to get clarification on that first.
Honestly, and I'm gonna just I'm gonna throw it out there. I would love to see employees have that day off, and I do have a question in here from the public. The first responders should also receive the extra pay. And so in the past, when this came up, that was the discussion. I think what really prevented it from happening because of all that extra pay that we would have to do. I think cutting that down to just Christmas Eve, and we won't worry about New Year's Eve. It'll just be Christmas Eve. I think it's Scott, if you can correct me, around $12,000 out of the budget. We have that money available today. That's not going to hit anything. And so, of course, that would occur as well. However, that works for the first responders and those that have, if I'm speaking correctly there, Scott.
You are, so that cost would be about $12,000, and that's because those first responders would still have to work on the holiday, so they get holiday pay. But one way we could handle this, the only other thing, and this is maybe a question for Troy, since this isn't an advertised decision, right, is if the council just provided consensus for the city manager to provide this year only off, and then consensus to for the staff to come back. We're in the middle of going through some changes in the personnel manual anyway. And so when we brought those changes back to the council for approval, if the council is thinking that they would like us to discuss or include that change, we'll include it so that you guys can take a formal action on that at some point in the future, at some point in the near future. Does that make sense? So we can handle the temporary this year piece and have the actual long-term policy in the near future when we bring that back at an advertised sort of action item. Troy, does that make sense to you?
Yeah, hopefully you can maybe hear me a little bit better. I think, yeah, that's the right way to do it is if the council wants to do it this year, just kind of do it on motion this year to direct Scott to implement New Year's Eve as a full day holiday. And then we can bring it back in January or even with the coming changes to the personnel policy to change it permanently and do it more formally to do a permanent change.
And just a point of clarification, Christmas Eve, just Christmas Eve.
Did I say New Year's Eve? Yeah, Christmas Eve.
Yeah.
I understood the motion you were asking to discuss, Mr. Mayor, was for this year. And I agree with it for this year. I'd like to see it come more as a budget, back to a budget
I think
discussion.
is that Scott what you're asking?
Yeah, I'll come if the council is okay with me on the long term taking a look at that, then we'll bring something back for the council to discuss for the future. Yeah, so the only action I would take would be for this year. Within the future years, it would be yeah, it would come back for council discussion for sure.
So would it be discussion as part of our budget planning process or something another time next year?
Just from a timeliness standpoint, we would do it when we're coming back with the personnel manual.
Okay.
But at that point, we will be talking about the budget and the impact on the budget. So that way, when we're actually developing the budget, we can be developing it with that policy in mind, if that makes sense.
It does.
Okay.
Okay. So I'm gonna go ahead and make that motion that for 2020 we offer or we provide the Christmas Eve as a holiday and kind of follow the lines of President Trump, where those employees who and I don't know how I'm going to best say this, but basically a day off from work and an opportunity to spend just a little bit more time with your families, especially in the middle of all this, and to bring it back later with the employee manual discussion and part of the broader discussion to get in the budget. So that would be my motion. And I've got Mayor Pro Tem.
I second that.
Okay, Ms. Duncan, did you have anything further? No, her mic's off. Okay, so we have a motion and second for approval to allow for the Christmas Eve holiday off for our employees. Again, it will also include the pay that you would get if you have to work that day because of first responder types of things as well. So again, I think it's around a $12,000 hit that is available in the correct budget as well, or in the correct line item as well. So Ms. Huffman, we have a motion and a second.
Mayor Ortega, how do you vote?
Yes.
Mayor Pro Tem Lauer, how do you vote?
Yes.
Councilmember Thompson, how do you vote?
Yes.
Councilmember Estes, how do you vote?
Yes.
Councilmember Applegate, how do you vote? Councilmember Applegate, how do you vote?
Yes, couldn't get my mic on, stupid thing.
Councilmember Geek, how do you vote?
Yes.
Councilmember Duncan, how do you vote?
Yes.
7 yes, motion carried. Thank you.
Okay, thank you for that. I do appreciate it, Council, and on allowing me to talk about that and just pushing that forward for our staff. And across the board, it doesn't matter. Everyone's done a really great job of just trying to manage this thing and keep us above it. And I think we've done a great job from Scott all the way down to everybody. So thank you all for all the hard work that you've done this year, and in the midst of all the craziness, all the stuff that has just been happening. And again, I think that's what 2020 presented for us, was an opportunity to show our resilience, an opportunity to show us what we can do. And you guys did that in great strides. So I appreciate every one of you and everything that you do for this community in our city. Okay, with that, I'm going to go ahead and keep plugging forward. And we're going to do our public to be heard section. Citizens may address the council on items that are not on our agenda. We ask that you email your questions to the city clerk part of the meeting at councilmeetings@fountaincolorado.org. Council may not be able to provide a meeting answer, but we'll direct staff to follow up. And out of respect for council and others in attendance, we ask that you limit your comments to 3 minutes or less. I'm going to go over to the attendees pane. And Ms. Huffman, did you get any questions tonight?
Yes, Mr. Mayor, we did receive an email from Ms. Chauvin, and I believe that she is on under the attendees right now.
Oh, okay. And so Ms. Chauvin, I'm going to unmute you, and hopefully your mic is working. So go ahead.
Hi, can you hear me?
Yep, we got you.
Oh, that's wonderful. Okay, I just wanted to make sure I'm not on camera.
You're not on camera.
Oh, that's awesome. Okay, because of the poor hair day. Okay, I'm gonna, I didn't know if I could get in tonight. I need to say that my internet is thready. This always happens when there's snow and or wind. So I may drop.
Okay.
So I'm not very organized because I wrote all city council members yesterday.
Oh, okay. Yeah, I did get that. Yes.
Right. And that was on the advice of Scott Trainer, who I've been communicating with since 2018, around something like June, who has been really nice to me and really acting like what I'm saying is actually something important. However, it has been stalled. So I'm here to say that I realize okay, I've got some notes here. I just got back from the eye doctor. So I realize that in the scheme of things, like running a city, especially during a pandemic, it's not a particularly urgent or possibly important issue. However, since June of 2018, I am still interested in serving, and this is a volunteer effort, in the post of Fountain, Colorado Poet Laureate, which has been just a kind of unofficial post. It is a government appointed post, and I'm still interested in doing this. I won't go into why I would rather volunteer with a title versus without a title, but there are reasons. I had provided Mr. Trainer with all of my books, my CV of accomplishments, honors, awards, etc., other publications, and miscellaneous. A poet laureate typically has a body of work and such honors, and I think he sees that I had those, and I don't mean to be taking advantage of bragging rights, but I have more. Okay. And I'm glad to, I'm glad in the intervening years, I'm glad to provide more. The main thing that you may want to know, I have another note here, the Fountain newspaper, Fountain Valley News, Karen Hill is now editor. They've been publishing my poems since I moved here. I moved to Fountain, which I love, by the way. I love Fountain. I need to say that. I've been here since I've been here 3 years, a little over 3 years. And they did bring out an article, if you want to look it up, it was in the December 9th issue, called something along the lines of Poet Still Making Art in Confusing Times. It was written by Connor Salter. And that would kind of outline my passion for words and art in general and so on. There are certain duties of a poet laureate. But I want to say that at the most extreme, you cut me off, I think I have a minute here. At the most extreme, community involvement, and specifically writing, and I've been involved in many things in Colorado Springs before I moved down here, has been shown to save lives. It does sound extreme, but it is true, and there are lesser benefits, but still important. In this difficult time, hopefully we'll be back together soon in person, but basically a poet laureate, and I can send, again, I had sent to Scott, and then I had an email crash in which I lost something like 20,000 emails, but I'm on a new device now. A poet laureate coordinates with, for instance, schools and really every community organization in town to build community, connect people, involve people in doing, in general, art, and is especially good for any disenfranchised groups, disenfranchised for any reason. So I outlined for Scott many ideas for projects, maybe 10. These were drawn from my Poet Laureate application for Colorado Springs, which no longer exists, but don't let that stop you. I wasn't considered there, not yet, because they were leaning more to people with a very strong academic background, and apparently 2 bachelor's degrees were not enough. So let me be quick to add that I have a master's degree in creative writing. I started pursuing that in 2018, actually, and it wasn't in order to get a post such as this. It's just something I wanted to do to be more competitive in my market. I work for Future Cycle Press. It's a publishing company, very reputable, out of Athens, Georgia. I'm a copy editor, proofreader, and production assistant for manuscripts already accepted. But my freelance work is for manuscripts that have not been accepted, but which people want to submit. But I want to make a general case that art in a community is important. And I think if any of you have a painting or a book in your home, if you ever listen to music, etc., you know the importance of art. Typically, a poet laureate receives a stipend, and that is for travel. That is for instance, creating a literary magazine, which is one of my dreams for Fountain. I don't want that. I don't need that. I'll find a way. I know how to get advertisers. I had given Mr. Trainer the elementary school literary magazine of art writing, poetry and prose, etc., that I had done for an elementary school in the Springs. And what we did was I found advertisers. My daughter and I put this together. It's a really nice book. I'm glad to provide it again. Hopefully I can find it. But we got advertisers, mainly the parents. But I'm not I used to be in public relations. I'm not shy about finding advertisers, and I can do it successfully. Lastly, just for now, I feel that having a poet laureate for the city who is involved in community building from youngsters, really toddlers, elementary school, first graders on up to our seniors is not only a good thing, it's kind of a prestigious thing for a city. It's kind of I don't know, just a cool thing. And that's what I want to say in applying for this post and hoping that maybe you might consider letting me apply. Thank you for letting me speak. I'll mute myself now unless somebody wants to ask me a question. Thank you so much for letting me join.
Oh, okay, thank you, for your comments. And I know I've, and when this came up and I got that email last night, I realized that this has come up a couple times in the past as well. And as you said in the beginning, it's just and truthfully, and I'll take the blame on it. It does it's one of those things that does get put on the back burner, and what we're doing and how we're moving forward. And I don't have an answer for you tonight whether we'll we'll be able to continue this. And at the time when we did have it, it was more of an honorary thing that we did for a local gentleman who you probably know, just to did a lot for the community, and
yes,
and that was part of his job with the paper as well. So
yes.
I don't have it again. I don't have an answer for you tonight. I know this has come up, and in the middle of everything that we've been doing as well, it's just been kind of like you said, it gets put on the back burner, and we'll get to it when we can. And obviously we haven't gotten to it. So I can tell you that I think we can, as a council, can discuss where we want to go with this. How do we want this position to be appointed? Because there's obviously it's a lot, and you're granted the one that's kind of bringing it back, and probably only one would apply. But at the same time, we also need to keep it fair as well for others who are like, hey, I want to do that as well. And so there may be some opportunity to look at this position and figure out how we can go about doing that. But I'll have to, we have a retreat coming up as a council that we can talk about this more internally, and go from there, and maybe come up with a decision of how and if we want to move forward with this position, and how that would look with our community and moving forward as well. So I agree with you. The arts are important in anything that we do, and as an educator myself, it's something I push very often with my kiddos. And so if you'll let us, hopefully we can. I got Scott on the line, and he's keeping track of the notes as well, and we can definitely bring this up for a discussion, and hopefully someone can get back to you.
Thank you so much. I appreciate the time.
Okay, thank you.
Okay.
All right, with that, I don't see any others. I did have a Oh, this has to do with the thing that we just passed. Ms. Kircher, would you like me to read that out now, or?
Yes, you can read that out. I'm not going to go any more than the written comment on it. But yes, please go ahead and read that.
Okay, so this comment was, I think it's about the, earlier, it says, my comment passed paid day off for fountain personnel without any public notification or opportunity to comment. Nice sentiment, but everyone is not doing as well as you at the City of Fountain, careless with citizen tax money. Thank you. We do have the money available to provide this, and you know, it is one of those things that I'm sorry, my screen just went weird. Hopefully I didn't lose everybody. Okay, I think I'm still there. You know, it's one of those things that it is a small amount of money, and for the hard work that they do, hopefully, you know, you know, people will understand why we're doing that and what we're doing. And while I realize that you know, everyone is struggling, but this is one of those opportunities that we're able to provide for our staff and keep the good vibes going as we move forward. So we will continue, and thank you for the comment. Let me see if there's anybody else. I am not seeing anyone else. Okay, so we're going to go ahead and keep moving forward. Item number 7, our consent agenda. All items listed on a consent agenda are considered to be routine and will be approved with one motion. There will be no separate discussion of these items unless a council member or citizen requests, in which case the item may be removed from the consent agenda and considered separately at the discretion of the council. We have items A and B. What would council like to do with these items? Let me see, Ms. Thompson.
I move to approve the consent agenda.
All right, Mr. Applegate.
Second.
Okay, we have a motion and second for approval. Ms. Huffman?
Mayor Ortega, how do you vote?
Yes.
Mayor Pro Tem Lauer, how do you vote?
Yes.
Councilmember Thompson, how do you vote?
Yes.
Councilmember Estes, how do you vote?
Yes.
Councilmember Applegate, how do you vote?
Yes.
Councilmember Geek, how do you vote?
Yes.
Councilmember Duncan, how do you vote?
Yes.
7 yes, motion carried.
All right, thank you. We are going to keep moving forward. We have no old business tonight. So we'll move right into item 9. 9A was consideration of items removed from consent, so we'll skip past that to item 9B. Resolution number 20-095, a resolution to approve agreements with Midstate Energy and the Colorado Energy Office to develop a performance contract project for the city. Mr. Trainer.
Thank you, Mr. Mayor, members of the City Council. The item before you is really the first steps to move forward with a performance contract for the city. And just by way of explanation, I know we've done this before, but for those in the audience who may not be aware of what that exactly means, let me give you a little bit of background. So back in 2016 and 2017, I think it was 16, 17, the city moved forward with a performance contract. And essentially what that is, it's the city working with an energy service company to come in and audit city facilities as far as the energy use in that facility, including water use, really the utilities. And to figure out if there are some improvements that that company can make to the facility that would save enough money on utility costs to pay for those improvements. And so the state of Colorado has a program called performance contracting, where they pre-approve a number of energy service companies to come in and work with local governments to improve their facilities. And the idea, again, is to improve the facilities and use the savings from those improvements to pay for those improvements. So we did that in 2016-17, made a number of changes to our various facilities. And then you go through a measurement and verification period after that, where you measure and determine if you really are saving those utility costs. And so we do that, and then you finance the utility improvements or the facility improvements based on those savings. So what I have before you now is another similar project. It's another performance contract. It's really step one. It's an investment grade audit. We have worked with Midstate Energy to perform a real general sort of feasibility study. They take a look at our facilities, and they do sort of a little bit of work, but kind of some of their best guesses as to whether or not they think we have a legitimate project moving forward. Then if they feel like, yeah, we think there is, and then we move to this step. And this step is really twofold. Number one, it's entering into an MOU with the state of Colorado, and the state of Colorado, through the Colorado Energy Office, provides us free of charge experts and expertise to help us walk through this. So they really hold our hands. They really, they're the experts in this sort of thing, and so they help us go through this. But if you go through this with the state of Colorado, they also ensure that the energy service company has to guarantee those savings. That's a contractual obligation. So if those savings aren't met, if those savings goals aren't met, then the energy service company cuts a check to the city of Fountain for those. So again, step one is MOU with the state of Colorado, and they again will hold our hand to this process. And then the second piece is an agreement for that investment grade audit with Midstate Energy. And so that's what you have before you. And so the agreement with Midstate Energy then would have them come in and do an in-depth technical audit of all of our facilities. Well, in particular, you can see in that contract, they're going to focus on really most of our facilities. You got all the firehouses, you got City Hall, the police station, museum. We're not doing anything with Lorraine because we know that we're shutting down Lorraine. But really, we want to get that investment grade audit completed. And then at that point, they'll be able to tell us, okay, City of Fountain, we do have a legitimate project. Here's exactly what that project would entail. I don't know what that would be today, but as they go through that audit, they'll be able to tell us. And then at that point, we would come back to the city council and we'd have a decision to make. Under one direction, we'd say, you know what, we just don't want to move forward with a project. Yeah, we know that project will be paid for through its own savings, but for whatever reason, we don't want to do that. Or the other path would be, yeah, let's go ahead and move forward and make those facility improvements and upgrades and so forth. And so that would actually come back at a future date. So at this point, it's really just the two actions, one with the state of Colorado and one with Midstate Energy, to take the next step into investment grade audit. That's a real overview summary. Does anyone have any questions on how that works? We also, by the way, just a side note, I also have Oscar is on the line as well, so he can help answer any real technical questions if there's anything I can't answer.
Okay, thank you, Scott. Let me get back to my attendees list here and see.
I should point out, as a reminder, for those, particularly in the council who were around when we did the last one, typically what will happen is there is a cost associated with this portion, this investment grade audit. You can see in the agreement, it's $26,000 to do that. What happens at this point, what happened at the last time we went through this is we agreed that, yeah, we'll move forward with the investment grade audit. And if there is a project, well, number one, if there's no project at the end of this, they determine, you know, there really isn't going to be enough cost savings to justify a project, then both parties walk away, there's no cost. If they determine, no, there really is a legitimate project, then at that point, the city pays for that investment grade audit, and we move forward with the project. Or if we decide we're not going to move forward with the project, then the city still pays for the audit. Now, Midstate Energy has waived that requirement to pay for this one. So if we decide, if Midstate goes to this audit and determines there is a legitimate project, but for whatever reason the city of Fountain decides to walk away, there won't be a cost associated with it. That's unique. I mean, the state of Colorado, they hadn't seen that sort of thing. So that's a really good thing for us, because that means there's zero risk to us at this point. I just want to add in that as well.
Okay, thank you. Ms. Thompson?
That actually was my point. I was going to ask you to clarify, Scott. I thought I had remembered the last time there was a potential cost if you didn't do it, but that's a fantastic offer if they're offering to do that for us without any cost. And that said, we did do some improvements to City Hall last time as a result of it. So they still have City Hall on here. It's still needing help.
Yeah, they'll take a look at all the things we've done. No, so those two projects will be separate. We are continuing to receive the energy savings from the existing improvements that I'm put in. I'm pointing at the ceiling because lighting was one of them. But they'll look at other things as well that maybe Siemens hadn't looked at, or Siemens looked at and determined, well, we're not sure. Siemens is a huge company, and so they have a different threshold on the types of projects that they can justify the types of improvements they make. Midstate takes a look at different things. They, for example, have a whole control system dashboard that connects all the facilities. And so they'll take a look at including that and seeing what kind of energy savings we can get from that. They're going to take a look at potentially some solar projects for us. And that's something that back when Siemens did it, there just wasn't a cost benefit, but the cost for solar has really dropped. So they'll take a look at a number of things. And it won't impact the existing projects that we had, or I should say the previous projects, but it'll be above and beyond.
Okay, so that was my next question. Was I wasn't understanding the point of table B, exhibit B, table 2, but so that's just like a wish list project?
Yes, at this point, exactly.
Okay, thank you.
Yeah.
All right, any other questions? Let me see. Mr. Geek.
Yes, does that include the new facility, the utility facility?
I got to think about that. Yeah. Well, hold on. Let me drop down the exhibit. I can't remember if we included that or not, because I know it's going to be included on the dashboard, but all the improvements that have just been made, I don't think they were going to do anything in the facility itself. Let me get down to that exhibit real quick.
It's the last one on table 1, but it has a $0 cost next to it.
Mr. Rangel saying yes, it does.
Okay. All right. Thank you.
Thank you.
Yeah,
I just was checking.
I was going down that exhibit, so thank you, Oscar.
Okay, let me unmute him just in case he wants to kind of chime in there as well. So you're unmuted, Oscar, if you want to say anything.
Good evening, Mayor Ortega and City Council members. Yes, that is included. It is not going, because everything is new. What we're going to take a look and see is how it was put together, and if there is a way for us to save energy based on their controls. So that's what we're going to look into it. But there is no cost to it. We didn't allocate that.
Okay. Let me check if there's any other questions. I'm not really seeing any. I like these things because it really helps, when we get questions about, where are we at with, our how do we do things to be sustainable and those type of things. So I think this really puts us in a good path to retrofit, to do those things that I wish a lot of places would do. I know the school district for one, maybe you don't have the money to kind of add those things as you're building, but hopefully later on you can have that stuff available. And again, with technology, and the further we get along with technology, the cheaper obviously it gets, as you said, Scott, with solar, everything is getting cheaper and cheaper with that, eventually it'll come to a point where, yeah, you can afford that and it'll make a good cost difference for you in the end. So yeah, neat stuff. So with that, I don't see any other questions, Scott. Ms. Duncan, go ahead.
I move to approve resolution 20-095, authorizing the execution of appropriate agreements between the city, Midstate Energy, and the state of Colorado for the performance of the technical energy audit for city facilities.
Okay, and so with that, we do have a motion, Mr. Applegate.
Second.
Okay, we have a motion and second for approval of our resolution. Ms. Hutton.
Mayor Ortega, how do you vote?
Yes.
Mayor Lauer, how do you vote?
Yes.
Councilmember Thompson, how do you vote?
Yes.
Councilmember Estes, how do you vote?
Yes.
Councilmember Applegate, how do you vote?
Yes.
Councilmember Geek, how do you vote?
Yes.
Councilmember Duncan, how do you vote?
Yes.
7 yes, motion carried.
Okay, thank you. We'll go ahead and keep moving forward. Item 9C, resolution number 20-096, a resolution approving an intergovernmental agreement between the City of Fountain Municipal Transit, FMT, and Colorado Springs Mountain Metro Transit, MMT. Mr. Evans.
Thank you, Mayor, Council. Good evening. This has been discussed several times when we've discussed our new county health facility. And what this is kind of the final piece. And I have to give credit to Craig Blewett and Mountain Metro. Scott helped with this. Sharon was involved with getting a meeting together on this, but Craig from Mountain Metro really took it and ran with it on the Colorado Springs side. And what this is it's an update to our IGA that we have with Mountain Metro. And this specific update allows our Fountain Metro buses to go to a transfer location within MMT's district, which is going to be located in Security. And that will be a transfer station that will allow the bus route from southern Colorado Springs that comes down into the Fountain Valley. We will then pick up at that transfer station and then directly take folks over to the county health building, where we will have 2 stops, one at the WIC office and one at the front entrance for the El Paso County Health. So this was something that was very important, both to the El Paso County Health Board, and Sam, feel free to jump in after, as well as the city of Colorado Springs, that we were able to get that transfer occur. The city council of Colorado Springs did approve this at their last council meeting. So your approval will put this into effect, and Rosa has been taking care of the adjustments to our routes. So this will ensure that we've got this in place when they open up the El Paso County Health Building. So that's all I've got, Mayor, unless anyone has any questions.
Okay. No, and I'm honestly, I'm surprised that the City Council of Colorado Springs acted so quickly on this. Mr. Geek?
I just want to thank Todd for all the hard work. Sharon helped us out a bunch. I really appreciate all the hard work that was done on this. And
Yeah, and
I hope the approval comes today.
Okay, yeah, and you know it's funny because when Todd was telling me about all this and this little piece of land that we have, it's like the mark of demilitarization zone or something. I don't know, just to get a bus to go
That's
from
correct.
one to the other, just to pick up people that need that service. And yeah, again, one of these things in life that should be so simple and easy, and it's not. And so thank you for all that worked on that and got that together. And oftentimes you just need the politicians to stay out of it and let the people who know what they're doing in there, and it'll eventually get worked out. So thank you for all that. I don't, I have mics on, but I don't assume they're questions. So I'm going to go ahead and go with, I'm going to stop talking. If there's a question, please ask. Okay, Mr. Applegate, go ahead.
Yeah, I'd like to make a motion. I move to approve resolution 20-096.
All right, and Ms. Thompson?
Hurry up and second it before they change their mind. Second.
Okay, so that's a second. We have a motion and second for approval. Ms. Huffman?
Mayor Ortega, how do you vote?
Yes.
Mayor Pro Tem Lauer, how do you vote?
Yes.
Councilmember Thompson, how do you vote?
Yes.
Councilmember Estes, how do you vote?
Yes.
Councilmember Applegate, how do you vote?
Yes.
Councilmember Geek, how do you vote?
Yes.
Councilmember Duncan, how do you vote?
Yes.
7 yes, motion carried.
All right, last official item for 2020. And so, right, I'm not missing anything. Okay, that's what I thought. I keep going back and it's like, okay, one of those things. I'm gonna go ahead and do correspondence, comments, and ex officio reports. I will start with Mr. Trainer.
Thank you, Mr. Mayor. Nothing for me at this time. I guess I should wish everyone a very, very Merry Christmas and Happy New Year as well.
Okay, thank you. Mr. Evans.
Quick update, Sylvia and I toured the DFAC building with Boyd Williams, the YMCA Pikes Peak Region Director last week, and they haven't made a ton of progress, but they do have their funding. Sylvia, correct me, I think Boyd said it was 1.6 million, and they have began the construction to turn that DFAC building into a new YMCA. So they're planning to open that springtime of next year. And when we went through, they did have construction workers in there working on it. So that's been talked about for quite some time and in the works for quite some time, but they are working it and spending that money in there now. So the Lorraine YMCA will not reopen They were nice enough, the YMCA was, they donated a large portion of their workout equipment that was at Lorraine to our electric department for their new workout room, our fire departments, as well as our police department. So a week ago, we got all those departments down there, and they're all going to utilize that equipment. So we do appreciate that from the YMCA. That's all I've got, Mayor.
Okay, thanks for that. I've been seeing the little news articles and things about, this and I was a part of the YMCA back in the late 90s, and was an employee there, and got to be on a couple of the boards there. And at the time, they were newer in the Fountain, but they were utilizing some of our facilities, and they used the DFAC at that time for the gym and the weight room, and had an agreement with the school district. And even when I was working with them, it was, hey, why don't you guys build a facility down in Fountain? And it fell on deaf ears. And so all this time, I know council members and mayors and everyone since then have been trying hard to get them to open, but they felt it more important to open north and put money in the facilities up there. And we had, a great opportunity down here that I think they just really let go. And at least I guess I am somewhat hopeful that maybe this will actually turn into something. I'm glad that they're not going to use old equipment. And so they're actually going to treat the people down here in the city of Fountain with some dignity and respect, and hopefully use newer equipment, and at least we get to use it and utilize it. And so, while I'm skeptical, hopefully this all does work out. And they've always given us the runaround down here in our community. And so, if they make this thing work and people enjoy it and take part in it, and then good on them. But really, it took way too long for that to occur. So while there's some good things that occur with this, and it's a neat thing, don't think the questions have never been asked. Don't think the push has never been there for a YMCA down here. They've really just ignored us up until this point. So again, it's my own personal soapbox thing here, but in my time here in this community and really pushing for something like this, especially from the YMCA, and seeing them kind of pass us over and go to other communities north, it's very disappointing. And so again, I think one of those things that we as a community have had to fight for, and for every claw our way into recognition that, guess what, we're a community, and we're a community of very strong people that desire these types of things. Hopefully in the spring they truly do open, but I'm a little skeptical at the same time. I'm excited as well, so we'll see how it goes. But maybe the leadership is changer that understand a region includes everybody south of Academy Boulevard. So we'll see what happens. Thanks, Todd, for that. Troy, anything?
Nothing else from me, Mayor. Thank you.
Okay, thank you. I did get an update from IT. There was no updates from them. Mr. Trilch, I think you're on.
Yes, good evening, Mayor and Council. Just 3 things for this evening. Well, actually 4. First and foremost, I wanted to thank Council for their vote this evening in supporting the employees with that extra time off on Christmas Eve. It's very, very much appreciated, and as an employee, I would like to convey my thanks for that. On the strategy video that many of the council members participated in, I saw a first draft of that today. It's looking really good, and we were going to show that this evening with an update, but decided to save that for the city council offsite and work session in January, which I think will be very appropriate, but it's looking good. I wanted to provide a brief update on our Ymca program. Our pest control Ymca with Fort Carson, we've been doing now since July. Participated in an update briefing with Fort Carson Public Works at the end of last week. They're very pleased with the service that Fountain is providing. There are no issues at all. And we have, by the end of this year, we'll have pulled in $16,698 in revenue on that pest control Ymca right into the general fund. And so that's going very well. We're also moving forward with the much larger projects of urgent military priority Ymca. Anticipate Fort Carson will be submitting that for approval of their higher headquarters in January of next year. So good progress there. Lastly, I just wanted to mention, since it is Christmas time, NORAD Track Santa is still going to happen. So they've not taken on the volunteers this year because of COVID, but the NORAD and NORTHCOM staff, all of the folks there are still going to make it happen. So children everywhere can tune in, call, get on the website, track Santa Claus, and so tune in for that. I would like to wish everybody a very Merry Christmas, and subject to your questions, that's all I have.
Okay, that NORAD Track Santa is kind of disappointing because my family and I took part in that the last, I think, 3 years, and it's a lot of fun. So good luck to them, because those phones ring nonstop and those rooms are filled with people. So there are kids calling from all over the place that are want to know where Santa is. So good luck. Hopefully they can keep up with the phone calls, but I understand we are where we are. So thanks everything on that one, John. Please send our regards in that.
Okay, thank you.
Okay, and Ms. Huffman.
Nothing for me. Well, I guess Merry Christmas to everybody. And I guess my final gift to you all is that I will be requesting an executive session tonight. Merry Christmas.
All right, thank you. And then with that, I'll go on over to council. Ms. Duncan, anything further tonight?
Okay, I just have a couple of things. This Friday is Small Business Appreciation. Can't stress enough for the support of our small businesses here in Fountain. Again, they have unique things that you can't find anywhere else. So I encourage everyone to support our small businesses here in Fountain. Good Shepherd United Methodist Church on Lita Drive in Security is opening its emergency food pantry every Thursday from 10 a.m. to 12 p.m. for anyone needing food assistance. The Christmas break is coming up for a lot of our kiddos. So the Fountain Creek Nature Center has programs that require prepaid registration. So call the Nature Center to keep our children active during this holiday season. They do practice social distancing. Call ahead just in case they have canceled any events. Also, the Whitefield School District 3 selected a new superintendent. His name is Kevin Duran, and he starts June of 2021. So congratulations to him. That's all I have.
Okay, thank you. Mr. Geek, anything further tonight?
Merry Christmas and Happy New Year.
Okay, thank you for that. Mr. Applegate?
Just one comment on the Y. I assume that'll be a lot better facility, but when they were offering Fountain nothing but the Lorraine Center at the normal price they charge everywhere else, that was just a little bit out of line for what they were producing there. And they seem to be a little bit high cost, but hopefully this is a better facility. That's all.
Okay, thank you. I agree. Ms. Estes?
Just Merry Christmas to everyone. And if you have time during the holidays, please consider getting out there and donating some blood. This is a very hard time of the year for them to collect blood. And just have a wonderful holiday season, and we'll see everybody next year.
Okay. Mayor Pro Tem?
Oh, just a Merry Christmas and a Happy New Year to everybody. And hopefully as we begin to see everybody in the new year, things are starting to settle down with this COVID business.
All right, I couldn't agree with you more. And Ms. Thompson?
Yeah, happy holidays to everybody and Merry Christmas. And I'd like to echo a couple other people's comments. I look forward to being proven wrong by the YMCA and having some changes down here, well overdue. And yeah, the price, let's make it commensurable to the facility that we have down here. Thank you.
Okay, and to everybody out there, my last comments for the year are just to, it's been a crazy time. It's been a weird time. It's been not the funnest time either. But I think, again, I go back to our staff and to the council and to the community for really pulling together, making things work the way they do. We've had our neighbors struggling. We've had people across the city, the state, the country, just going through some weird stuff this year. And just trying to support each other the best we can. I think, again, as a testament as to what 2020 is we're gonna look back on it this year and see what we've been able to accomplish in spite of all this stuff. And fingers crossed and prayers that this vaccine does work and it gets us to a place that we can start going back to concerts again and parties and doing all the things that we love to do with people. And we're a community that loves being around each other. And I think that's the one thing I think we all miss the most. And so, past all the other stuff, I do wish you all a very Merry Christmas. Hopefully it's restful. You get a chance just to relax and just have some peace and quiet in your lives and in your lifetimes with your families, however you choose to spend that. And of course, best wishes and best of luck as everything starts ramping up for our new year and moving forward. So I do appreciate you all, and I thank you for allowing me to be a part of this in this way. And it's something that I relish and I'm very thankful for in my own life. And with that, I want to hand it back over to Ms. Huffman because apparently we have to do executive session tonight. So go ahead.
We do. I'd like to request an executive session pursuant to CRS section 24-6-424B for the purpose of determining positions relative to matters that may be subject to negotiations, developing strategy for negotiations, and/or instructing negotiators.
Okay, with that, council. Mayor Pro Tem.
I move to go into executive session as requested.
Ms. Duncan?
I second.
Okay, we have a motion and second to go into executive session. Ms. Huffman?
Mayor Ortega, how do you vote?
Yes.
Mayor Pro Tem Lauer, how do you vote?
Yes.
Councilmember Thompson, how do you vote?
Do I have to vote?
You don't have to vote. Abstaining is a yes vote.
I'm just kidding. Oh, approve.
Councilmember
Yes.
Estes, how do you vote?
Yes.
Councilmember Applegate, how do you vote?
Yes, I guess.
Councilmember Geek, how do you vote?
Yes.
Councilmember Duncan, how do you vote?
Yes.
7 yes, motion carried.
All right, so with that, we will see you all on January 12th, 2021. We are adjourned. Council, remember to call that number in for our executive session. Hopefully everyone has a good evening.
Can we take a 10-minute comfort break?
Yes,
Sure.
it's my preference that I have at least 5 minutes to get upstairs to prepare for the executive session.
Okay, so 8:05.
Sure.
Thank you.